Welcome to today's webinar. Today's topic is survey success, creating and maintaining a culture of vigilance. I'm your host, David Tapia of Exegete Healthcare International. I'm very glad that you can join us today. Today we have a very special guest, Jill Dyer. She's a senior level consultant and owner of JID Consulting. She's undoubtedly one of the most well-informed compliance consultants in the industry. It's good to have you on the webinar today with us, Jill.
Thanks. It's good to be here, David.
Excellent. And this is a wonderful, timely topic. But before we actually get into the content, into the meat and potatoes of this exciting topic, so before we get started, I've got a poll that I'd like to launch here, and I think it's a good litmus test, and it's a good question that we ask ourselves. How does our agency prepare for survey? How do we do this in our organizations? So do we fly by the seat of our pants and we don't prepare? Or we do it when we feel like we're due for survey? Do we conduct regular mock surveys? Or are we preparing year-round? And so as the results come in, I encourage everybody to participate. Go ahead and fill out that poll question. It just takes a second, and it's going to give us a glimpse of how your agency prepares for survey. All right, responses are still coming in, and we have a couple. I can see a trend here. The folks that are on this call are very concerned with preparation, so that looks like it's being reflected in the results. So I'm going to close the polls in just a second here. All right, we've got a good representative sample. I'm going to go to skip to the results, and it looks great. We have a lot of folks that are on the right page, and they are preparing year-round for their survey. We've got a couple in the we don't prepare category, but don't worry. At the end of this webinar, you're going to be motivated to prepare and to get to the next, take it to the next level there. All right, so we're going to go on and close the poll. I'd like to start by just saying, we have a couple of goals for today's webinar, and that's to discuss a few factors that we found that are commonalities among top-performing agencies that consistently get survey success, and so they consistently get good results. We'd like to provide a basic understanding for even those of us who are survey veterans about that survey process. It's always good to go over the basics. And we'd like for you to be able to understand what the surveyor needs in order to do their job, because the better you're prepared to meet those needs, the better the results. We'd also like to encourage for everyone to have a survey-ready plan. If you don't have a survey-ready plan, we're going to give you the tools to do so, and you'll be able to download those tools at the end of the webinar. So again, for purposes of this webinar, you can see it at the bottom there. We're just going over a standard home health agency survey according to CMS guidelines. Remember, if you have a special accreditation such as Joint Commission, CHAP, or ACHC, you have other standards to meet above and beyond this, what we're talking about. So make those adjustments as well. So let's talk about how high-performing agencies prepare for survey. And I think that when we were developing this topic, we were talking about vigilance. And vigilance is a key component that we have found as part of all of these healthcare organizations who achieve such great results. But it always starts from the top. So the leadership has to have compliance and preparedness as a top priority. So I've always been trained that the leadership needs to set the example, they walk the walk, and they talk the talk. So if your leadership at your agency is compliance-oriented, they make that very well known, and if you're an agency leader right now, just make sure that you're vocal about the priority for preparedness and compliance. And your folks, your staff members will follow. And so definitely foster a culture of vigilance or readiness. If you want to think about readiness, mission preparedness, a lot of those are military terms, but let me tell you, that works today, and that works for high-performing healthcare organizations. despite having the culture, the vigilance, you might be setting the example, but ask yourself, does my staff, do they have the resources that they need in order to actually achieve a good survey, to achieve a successful survey? So if they don't, let's equip them with those resources. And adopt a continuous quality improvement mindset, because part of your quality program is ongoing. So why not capitalize on that, build on it, and let's adopt those CQI concepts, and let's always think about how can we continuously improve our processes, how can we continuously affect our outcomes. Those are some things that allow us to be prepared to have a better result for our survey, but also make sure that you test out your agency. And I like the word tensile strength, because through mock surveys and random audits, you'll be able to really put your agency through the test. Nursing vigilance. I think since most of our frontline staff are skilled individuals, we can take several concepts out of the nursing vigilance article that was on one of the online journals here for nurses. And basically, it outlines that vigilance is something that in a clinical setting can allow you to always be aware and to always use as you can see where it says watchfulness on the fourth bullet, to always use that and to have that mentality. Some other characteristics of high-performing healthcare organizations is that they are all about accountability and responsibilities. They don't tolerate low performers. That goes hand in hand. Holding people accountable allows you to address any underperforming measures, and we have to have some organizational alignment. If what the leaders are saying and the leadership is not consistent with what's going out with the boots on the ground and your field staff, there's no organizational alignment. So that's going to fall to consistent leadership and consistent leadership tactics. And if you adopt standardized best practices, not bad habits, you're definitely going to set your agency up for success. So I like to say, scrutinize your agency before someone else does. And so with that being said, I'd like to allow Jill to take over, and we'll go from there. So Jill has some great points about survey success.
Thank you, David. Well, it's good to be here with you all, and I'm going to kind of cover the particulars and a few more specifics about the survey and what you can expect when the surveyor shows up. So first, what we need to realize is kind of about the background of the survey, and most of our surveys today are similar to what they've always been. However, there's a lot more focus on actual patient care and quality of care, which I think is a really great thing for our industry, because in the past they focused a lot on our policies and procedures and not so much on the care we actually provided. So they've really developed data-driven, patient outcome-oriented, and patient-focused surveys. So they're looking at our data. They get that data from how we fill out our OASIS and the answers that we do to those, admission, research, transfer, discharge ones. They look at what our outcomes are. They're looking at more of our patients and the care that we actually provide. And the way they do that is much more effective and efficient in assessing, monitoring, and evaluating the quality of care that we do deliver as a home health agency. The following is going to be an example of the G tags that surveyors refer to when doing a survey. This slide is available to you from a download from CMS. CMS has a lot of really good information on what you can expect when the surveyor comes. If you're a good Google freak like I am, you can go in and just very easily Google these things. You'll get articles that folks have written on it, and you'll also get lots of CMS information, and I really recommend going to the CMS website. But this is an example of the G tags. So remember when we all decided to become home health care administrators and home health care director of nurses and owners, we said that we would comply with certain conditions of participation. And that's what these G tags are. They are the conditions of participation. And under each of those conditions of participation are certain standards. So you have what we call G tags on each of those. So when the surveyor comes in, they're looking at particular G tags. When they cite you in a survey, if they say you have a deficiency, they're going to specifically cite one of these G tags. So this particular handout that is really helpful to us is highlighted when you pull it up on CMS. It's highlighted in green and yellow, and the green tags are going to be more of the ones that they're looking at in the standard survey, and we'll talk a little bit more about that as we go along. But for instance, you may have one that's a condition of participation on patient rights, and that would be a level 1 standard that they're looking at. So you would want to become familiar with these G tags, and you would want to become familiar with the ones that are the most important, the highest priority. And you can get that by going to CMS and pulling that up. Basically, there's 3 types of surveys that are done today. You have your initial survey, which is going to be a standard survey. That's when folks are going to come out, the surveyors are going to come out, and it's time for your survey to be done, and they're going to do a standard survey. There's certain things that they're going to look at in that standard survey, and again, you can go back to those G tags and see what the main focus is that they're going to look at. And that way you will know exactly what they're going to be looking at when they first come in the door. From that, when they do the standard survey, if they find out or they see that you are deficient on certain G tags, then they may move into a partial extended survey. If at that partial extended survey they feel that you are deficient in some other tags, they're going to move into an extended survey. So kind of depending on the size of your agency and which one of these surveys they end up doing will depend on how long they're actually at your agency. There's a wonderful handout called Survey Protocols that comes from CMS, and it very specifically will give you the guidelines of what they're looking for and which G tags they look at, and if they find 2 G tags in one particular area, then they would move on to another one if you are deficient in those areas. For instance, if you are deficient in G100, which is patient rights, if they find that you are not informing your patients of their rights so that you don't have that documented, most likely you give it to them in a handout when you do an admission, and they probably sign a consent that says that you gave that to them. If they find you're not doing that, and they find that you're not letting the patient participate in planning their care, they're going to go on to another partial extended survey because they're finding that more than one thing under that particular G tag is not being met. They're going to do some preparation prior to coming to your agency. They won't just walk into their office one morning and they say, go out to ABC Home Health and they'll hit the road. They're going to do a little preparation when they know which agency they need to go to. First thing they're going to do is that they're going to review your file. And they're going to look and make sure that you are at the address that you have turned into CMS, your 855A. They're going to make sure you still have that same ownership, that you still have the same leadership in place, your administrator and director of nursing, business manager if they're listed on the 855. They're also going to look at any complaint data that has been called into the state or Medicare. So if you've had complaints called in on you, they're going to have reviewed that so that they have an idea if there's any trends going on with your agency. And then they're going to look at, this is also very key, they're going to look at your previous survey data. Do you have any data that they should be looking at from your previous one? In other words, were you cited on something? Did you have a deficiency? Did you do a plan of correction? And if so, are you doing that now? Even if that was 2-3 years ago, are you no longer deficient in that area. If you find that you are deficient in that area, you need to go back and diligently write another quality improvement plan so that you can become compliant in whatever it was that you were not compliant before. Then they're going to review and generate reports from your OASIS data. And we're going to talk about that as we go along here. That basically means they're going to look at your CASPER reports. If you don't know what the CASPER reports are, again, Google that, look that up. That's just like the ghost, CASPER the ghost, CASPER. And that is the reports that you should be looking at on a quarterly basis at your agency. And your quality assurance team should be reviewing that and making sure you're within compliance. You get that by going to the same place where you export your OASIS. The people at your OASIS help desk should be able to help you. There's guidelines online that tell you how to pull those CASPER reports. And if you do that and you're still a little confused, you can contact a consultant to help you, but you should be reviewing those reports. This is a worksheet that many of the surveyors are going to be looking at prior to coming out. One of the reports they're going to look at, and I'm going to show you as we go along here, is a potentially avoidable event or the adverse event. They used to be called adverse events, and they updated that to be a little bit more appropriate, and now they're called potentially avoidable events because that's what they are. They are events that could have potentially been avoided had we changed our care to that patient. And that's what you do when you look at those patients and review them, and that's what your surveyor is going to do. They're going to see, is this an event that could have been avoided if the care would have been a little different? So if you have patients who are listed in this Tier 1, if you'll notice up there it says Tier 1, AE outcomes, and under that is emergent care for injury caused by fall. If you have patients who are under that Tier 1, they're identified under that, they're going to likely pull that chart. And again, I'm going to show you in the next couple slides where you can get that information and what it looks like. So each of those events are listed. The Tier 1s are the most crucial that they're going to be looking at. But if you don't have any patients listed in the Tier 1, they will go to the Tier 2 and review those. So you should be reviewing those charts as well. And then over to the right, you can see if they feel that the data that's there is pertinent. If you only have one patient listed and you have a census of 250 patients, that's probably not really data that's that important. There was only one patient of all those that had that adverse, potentially avoidable event. But if you have 6 people listed, it might become more of the something that they really want to focus on. So they're looking to see if that was something they should focus on or not. Then you go down to kind of the center of the page where it has the OBQI, the outcome report, and then the case mix reports, and they're going to review those again and see if you fall within the reference value. If you don't, they're going to investigate those patients further. So they're looking at your patients that you have in your agency to become familiar with the trends that are going on within your agency. And again, we're going to talk about that a little bit more. So if you're still thinking, I'm not sure what she's talking about, hang in there with me. We're coming to some more slides that's going to show you. This is the second page that they're going to look at on that worksheet as they're preparing to come out to your agency. They're going to pull your OASIS transmission information. They want to see how many errors you're having, what kind of errors you're having. They want to look and see if you are submitting your OASIS on a monthly basis. You need to be submitting your OASIS within 30 days of the MU90 date. So the date that that OASIS is completed, you have to export that within 30 days of that MU90 date, within 30 days of completing the OASIS. It used to be that 7-day mark. It's now 30 days. So are they submitting it? Is your agency submitting it within 30 days? There may be some instances where you don't, but they're looking at if you have over a 20% of your OASIS are being exported late, that's going to be an issue, and they're going to be addressing that and trying to find out why from you. They're going to ask to see your transmission data and have a discussion with you about that. So the survey preparation, they're going to look at potentially avoidable events reports, and I'm going to show you those, the OBQ outcome reports. They're going to look at your patient agency characteristic report, which is another report from Casper that you can get that is going to tell you all about the patients that you typically see. Do you have a lot of diabetic patients? Do you have a lot of wounds? Do you have a lot of orthopedic? What is kind of the focus of your patients? Many agencies have certain things that we're better at and that we focus on and we market towards. You might do a lot of IV patients. You might have a lot of infections. You might be a very wound care-oriented agency, so you might have a lot of those. But that patient agency characteristic is going to tell you that. And then they're going to look at your submission statistics and your error summary report, and those have to do with your OASIS data transmission. This is an example of what your potentially avoidable event report would look like. These are not real patients. This comes from, again, the CMS website. They have manuals that go through all of this. They have OBQI manuals, OBQM manuals, and again, I would encourage you to go in, download those, and look at those manuals. And that's where this particular slide came from. You can see the first one listed is emergency care for injury caused by fall. This particular agency has one patient listed, and you can see then it goes on down to emergent care for wound infections, then on down to improper medications, etc. And they have the patients listed. Sometimes you don't have any patients listed. For instance, on this one, if you go down to number 3, there's no patients listed. So that was nothing that this agency had an issue with. But it's very likely that your surveyors will pull these charts for these patients to look at what they are and want to review those to make sure that you really don't have some trends going on within your agency. And you need to be reviewing these on a quarterly basis to show that you are making sure that you don't have any trends. If you do have trends, for instance, in this agency, you might have a trend for the decline in management of oral medications. Why do you have so many? Are you answering the question wrong? Are you not doing correct patient education? You audit this. You put a program together to improve that quality. And if the surveyor comes out and you can show them that you've already identified that and you're working towards helping with that, making that a better, improving those qualities, improving that outcome, you're going to score higher with that surveyor because you've already identified that, you're already working towards that, and you can show them that you are doing that. So you want to look at your OBQI outcomes, you want to look at your patient agency characteristics, you want to look at your submission statistics by agency report, and you want to look at your error summary. These are all Casper reports that you can get specific for your agency by going in and pulling that information. I like to talk about this because the first critical stage of the on-site surveyor process is really what the perception of that surveyor is when they come in. They're going to ask you for some things that they need. They're going to want to know an unduplicated census of patients. They want you to be able to hand them in a very timely manner, meaning within 30 to 45 minutes, they want to know who is the list of your current patients, and on that list they want the diagnosis, the physician, the start of care date, and the disciplines that are involved in that patient. They want to have a schedule of patients who are receiving services this week, because remember now our surveyors go out on visits with our staff. So you want to be able to provide them with a list of who's being seen this week, and it needs to be an accurate list. Then they're also going to want to know who your current list of employees are. They're going to want to know their title. Are they an RN, a PT, office staff? And they want to know, are they contract or are they working directly for you? So those things you need to be able to supply to them quickly. So these particular items are ones that you want your staff somebody in your agency to be able to gather that data, gather that information quickly, and give to the surveyor. After they introduce themselves and explain the surveyor process, and ask for those items that we talked about, they're going to give you an explanation of what's going on. They're going to request from you what your organizational structure is. They're going to want to know who's in charge, who's your administrator, who owns you, what's your delegation of responsibility, etc. And then they're going to want to know if you have any additional locations. Do you have any branches that go from your parent office? And then they're going to request that they meet with your appropriate staff based on the organizational structure and characteristics that you give them. They're probably going to meet with have one meeting with you, your administrator, DON, owner, and other people that you may want involved, and then they're going to request to interview some of your other staff too. They're probably going to want a copy of your organizational chart. And I just wanted to say on that we are going to be sending out to you a survey-ready checklist and a survey-ready manual, so that suggestions of what you would want to have in a manual and suggestions of what you would like to have. So the items that we just went over, you're going to get a checklist to be able to look at those a little bit more clearly. Basically, you're going to need to provide access to the following information and be prepared to provide an explanation of these documents. So what I'm saying is that your surveyor is going to want to know for each patient, what was the admission information you got? What does it look like? Where's your original order? What's your history and physical? They're going to want to see your consents. They're going to want to see your case conference notes. They want to be able to look at your home health aid supervisory documents. Make sure that you're doing that every 2 weeks on your home health aid. They're going to want to know where your documentation of your drug regimen review is. If you have electronic medical records and you have information scanned in, where are those items scanned in? These are the items that you need to be able to say to the surveyor, this is where you would find them on our chart. If you have a paper chart, where are they on the paper chart? If you have electronic medical records, where can they find those on electronic medical records, so that they're not lost and they know where you're at. One of the key things is really being organized and appearing prepared for them. You will have to grant the surveyor access to any records that they request. If you have an electronic medical records, you're going to have to create a user account for the surveyor. And then you're going to need to assign a specific audit-only access. You don't necessarily want them to be able to go in and assign visits or do anything. You want them just to be able to audit a chart. And they need to have access to each of your patients' charts if they so choose to do that. You want to sit down with them again and show them signed physician's orders. So if you have an electronic medical system that does not have copies or does not show the actual signed order, you don't scan those in, you have those in a hard copy chart somewhere, you want to be sure that you can provide that to the surveyor, because they want to see the signed orders, make sure that they're looking to make sure those were signed and dated and that it's legible signature, etc. And if you only have the order in your electronic medical record that you sent out to that doctor, you don't have a copy of the signed order scanned into that, you need to provide them with the actual hard copy so that they can see that. They're going to want to look at communication notes, so you need to show them where you keep those. If you have hard copy charts, maybe you don't put your consents in an electronic medical record, you need to be sure that you provide that to them as well. Again, as I mentioned earlier, having a manual that you prepare in advance is very helpful both to you and to the surveyor, and we're going to send you some information on what you might want to put in that manual. You also want to decide prior to the surveyor visit where they're going to be. Look around your office. Make sure that you're sitting them somewhere that if you have electronic medical records, that the computer works at that location, that it's connected to a printer, because they many times want to print off certain information to take with them. And you need to make sure that you have some way of letting all of your staff know that the surveyor is there. I had an agency that I was part owner with, and one of the things we did is we were able to send a mass text. We used that for emergency preparedness situations, for reminders of meetings, and that we also used that when a surveyor came. There was a mass text that went out to our staff to let them know that the surveyor was here. You want to appear confident. You want to be cooperative. You don't want to be flustered. You want your offices to look organized and prepared to have that guest in your home, basically. So pretty much the summary of what we've kind of talked about today is that you want a review of that home health survey process. You want to review that with your staff. You at the top, as David mentioned earlier, you're the one who sets the tone. When a surveyor comes, are you in panic mode? Because if you are, everybody's going to be in panic mode. But there's no reason to be in panic mode if you start preparing now or if you have prepared. You've talked to your staff. You have kind of a survey team at your office ready. They know what a surveyor needs. If you're going to be out of town or you're out doing visits, be sure somebody in your office knows where that information is and how to get it. You want to be sure that you have looked over the data that you know that surveyor is going to be looking at prior to coming to your office. And you also want to make sure that you have the information available at your fingertips to give to the surveyor when they come. We're also going to be sending you a survey-ready plan that you can, kind of a checklist to go, okay, we've done this, we've done this. Please remember that if you are, as David mentioned earlier, if you are accredited by TJC or ACHC or CHAP, you're going to have some additional things that you're going to need to do, so you'd want to refer back to your manuals for those accreditations. But the majority of the things that you need to cover with CMS is easily accessible at their website. So I think we're going to get ready to take some questions now. So David, I'm going to turn that back over to you.
Right. Thank you so much, Jill. This was very informative, and we've got a lot of interest. We have a lot of folks that are asking questions. Number one, we have a lot of folks asking questions about the slides, and I think that's wonderful because that means that there's information here that you want and that we will provide for you. I will let you know at the end of this webinar, we have we will be providing a copy of these slides via email to you. And so you will just kind of stay tuned with your inboxes because you have a couple of things coming to you. We don't like to just present and leave. There are some things coming to you. You're going to have a great time planning your survey. It's going to be very helpful. We have some questions now. We have a lot of questions regarding those resources there, Jill, about, where do I find my CASPER report? What is CASPER? And where do I find OBQI information? Is there where in that website on CMS do you recommend, or at least what's a good first step for people, Jill, to find this information?
Well, I think one of the best ways to get that information, a couple things. One, like I said, I'm kind of the Google queen. So I'm one of those people that when you're out to dinner and you have a conversation and somebody brings something up, I'm like, oh, I'll just Google that. So that's kind of my answer to things. I like to go in and Google. And I would Google CASPER, CMS, CASPER reports. But beyond that, because everybody needs a little bit more than that, I understand, is that when you get to the cms.gov website, you need to download the OBQM manual. There's a PBQI manual, the OBQI, and I know as an administrator and a director of nursing, it's overwhelming, all these OBQI, QM, all that Q stuff. But remember, they're all really interrelated, even though they're a little bit different, but they're very related to each other. They all have to do with quality reporting. It's how CMS is looking at our agencies, and they're taking the data that we give them through our OASIS, and then they take all that data and put it together. One of the things that we forget is that the OASIS questions, the M questions, is really just a gathering of data information to be able to put into a computer and spit back out some information about quality of care that we provide.
Right.
So
we're telling on ourselves almost, right, Jill?
Yes, we are.
We give them that information.
Pull those reports.
That's right. I'm going to send you guys a link, and I'm sending it right now to everyone. It's going to show up in your chat box, and it is sort of just the main page where you can download tools, download the OBQI manual, download the CASPR reporting application. If you don't know what CASPR is, good chances are your quality folks are the ones that are transmitting. But it's still good to know that as a decision maker. So we've got a couple of the questions. I have some good questions here that we've been keeping track of. Now, one of the folks said, well, some CASPR reports are not available for review at exactly each quarter. Is there somewhere else we can look, or what do we do?
Well, there's kind of a couple answers to that. When you're looking at the potentially avoidable events, you're going to be looking a quarter back. So when you're doing your quarterly report for quarter one, January, February, March, you're going to be doing that in April. You're going to be looking at January, February, March. But the data for the potentially avoidable events is actually going to be from quarter four. The way to kind of remember that is you're not going to know exactly what those potential events would have been that quickly, so you have to give it a little time to get all downloaded into CMS. So those are for the quarters back. The other thing is that many softwares companies have data available to you, and there's software scrubbing companies that have data available to you in real time. So the minute that you put information in about a patient into your OASIS, if you run it through one of those scrubbing companies, or you look at your reports in Kinzer, for instance, you can look and see what your outcomes were from any discharge OASIS that were filled out even yesterday. So you can get some real-time data and know what's going on in your agency. You don't really have to wait till 6 months in the behind.
Right, and I appreciate that, because remember, QAPI is always retroactive, guys. You know, we're always looking behind us at the data. It's about data gathering. We have a question. It's a very simple one, but you know, I know that you can elaborate on that. Well, what is a PBI manual? Could you elaborate on that and the importance of it?
The PBI manual is the Process-Based Quality Improvement Manual. So remember, process-based means you have a process in place to meet needs of patients. For instance, are you doing a fall risk assessment? Is your process in your agency to do a fall risk assessment on each patient? I hope the answer to that is yes. It likely is yes. So the PBQI manual is going to tell you how to look at some of those OASIS questions that are process-based, and you're going to be able to look at the quality that you're providing, and if you need to do some improvement on that, for instance, maybe you find out that your data shows that you're not doing fall risk assessments. So then the question becomes, are you really not doing fall risk assessments? If so, you need to put together a quality plan, improvement plan to do it. Or are you doing it, but the clinicians didn't understand how to answer that particular M question appropriately, so it looks like you have bad outcomes when you really don't. So that manual is going to tell you how to look at those processes.
Excellent. And we do have another question that's actually going to lead into our power lunch that we're going to have on Thursday. So somebody is saying, are there reports in Kinzer that forecast what's in a CASPR report? I think that the more poignant question would be, are there reports in Kinzer that that provide the same data that is that's in the CASPR reports? I urge you strongly to follow up with us and to attend our webinar on Thursday, our Power Lunch. But the answer is yes. There are multiple reports that we'll go over that are in Kinzer that actually show you the same information as your CASPER report, as some of your CASPER reports, of course. So, and then are there anything you want to elaborate about the Power Lunch, Jill, since you're going to also be our guest?
Well, I just think if you're I think the fun thing about that Power Lunch is going to be that we're going to actually take you into the Kinzer program, and we're going to show you some screenshots of what some of their reports look like, so that you can see the advantage of making sure that you are on a software that allows you to pull up the data that you need and allows you to monitor your staff so that the data can be so that you can look at what needs to be done in your agency, you can look at the quality, you can evaluate it, and then you can make the changes that you need in order to provide better care and have a better survey. But the key to you as leadership is being able to pull that data easily. And I think you'll find out at our Power Lunch that there's some really awesome reports that allows you to do that.
Right. And another follow-up question more about the OBQI measures is that if an agency is Medicare, has a lot of Medicare Advantage plans, and they have, Advantage patients with chronic diseases, this administrator is saying that when we submit, our OBQI results drop because of the chronic diseases. And she asked, will that be taken into consideration by the surveyor? Could you elaborate how chronic diseases affect your OBQI numbers and how that's viewed by a surveyor? Because I think she's touching on a really, on a nerve there, because we have to understand how surveyors look at our data and interpret it in order for us to know what we need to do in the disease management, case management, and quality process.
That's a great question and good way to summarize it, David, because I think I know all of us out there are taking more of those patients, and it is very frustrating because I understand what you're saying, that you many times our quality appears to drop because we're caring for those patients, that we don't have as much control over how the care that we really provide to them because we're limited maybe on the number of visits that we're able to provide. And that really can be very frustrating and difficult to deal with. But the thing to remember as far as what a surveyor is looking at, they're looking to come out and see why is the data that you have what it is and what are you doing about it. In other words, if you have a lot of patients who have chronic diseases, number one, they're going to show up on that patient characteristics report. And remember, our data is also risk adjusted. And that risk adjusted basically means that the computer program is able to take into account that the patient has many different disease processes going on, and they're adjusting the outcomes based on that. So some of that is being adjusted by the CMS the CMS data that's being put out. But what the surveyor is also looking for is, are you doing anything about it? So if you have let's just say your improvement in patients improving in bathing is not high. You're very low in that. You don't have a lot of patients who are improving in bathing. And why not? And your just gut answer is, well, we have a lot of Medicare Advantage and we aren't able to provide all of the therapy that we need to get that patient up and going. Well, what you need to be able to do is show some data. Show that you have in your quality, your quarterly audits, on a quarterly basis you should be doing some audits, and you should be auditing those patients. Let's look at our patients who have OT, who have home health aid, and how quickly we're getting out, and why are those patients not improving, and put together some sort of an assessment tool, and then put together a plan. And maybe part of your plan is going and discussing that with your Medicare Advantage programs. See if they'll give you some more visits. See if you can get 3 or 4 OT visits where maybe they haven't been giving you that in the past. But The surveyor is going to say to you, what are you doing about that? What are you doing about that? That's what the surveyors are looking for. How are you trying to improve your quality? And if you can show that you are trying to improve your quality, and this is what you've done, and you've gone and you've spoken with those Medicare Advantage programs, that's going to give you a lot of weight when that surveyor comes.
Well, I just want to thank you, Jill. This has been wonderfully informative, and I think we've touched on a couple of commonalities as well, and that is identify the problem, make an action plan, and do something about it, because that's going to really affect how we do in survey. We do our due diligence first, and it kind of goes back to that, scrutinize your agency first before someone else does. So I'd like to thank you for being on our webinar, Jill, and I look forward to seeing you again on Thursday with our Power Lunch.